Change is generally defined as becoming something different or the act of causing something to become different. People who are anxious or stressed may resist changing, preferring to stay in that regular routine where they feel most comfortable and secure. But we all change whether we realize it or not. I may love to wear flip-flops and shorts, but I will change to warmer clothes when the season is colder. I want to be comfortable and I need to change to stay that way. I may dread the change of the season and the colder weather, and I will miss my flip-flops and shorts, but I will embrace my long johns and my coat and be happy to wear them. Other people thrive on the excitement of new ideas and perspective changes. The idea of learning something new and finding a better way to do things is a great motivator for me, and I feel it reduces the risk of burnout. As nurses, we ask people to change every day. We ask them to stop being couch potatoes and to choose to exercise more. We ask them to step away from the French fries and eat more fruits and vegetables, and they are immediately willing to do whatever we ask. Right? No, they aren't. Patients resist change unless we give them more information about the potential harm or benefit of their choices and actions, and even then you may have to reach them on an emotional level and ask them to think about their loved ones and what may happen to them if they don't change their ways. Professionals should look to change and have a pioneering attitude and look forward to it. Let your own attitude exhibit how you embrace the possibilities for change. Talk about exciting new ideas that you have discovered and listen carefully when team members bring innovative ideas to your attention. When you interview a potential new hire for your team, keep this attitude in mind and ask probing questions to determine if this is someone who shares your vision. Change is not easy to implement because people are motivated by different things, but I will discuss the key steps to prepare and implement change by talking about 3 phases. Phase 1 is assessment, scanning your environment to determine where you currently are. Phase 2 is team reflection, where you look at the information you gathered in Phase 1 and determine your team members and gather input on the present situation and where it is you want to go. Finally, in Phase 3 is integration phase, the assimilation of data from Phase 1 and Phase 2. All information is reviewed and decisions are carefully made. The team will develop an action plan for change from the information gathered. Planning with objective thoughtfulness is key. I want to look at these steps from the perspective of a home health agency making the decision to change from staff members driving personal vehicles to a fleet of vehicles owned by the agency. Phase 1 is assessment of your current situation, scanning of your environment for the efficiency of current actions. Look for wastefulness in spending of money or time. Examine other hospitals or agencies who are making new advances, maybe things you haven't thought of. And look for the strengths of your current actions. With reimbursement changes in Medicare, many hospitals and agencies were looking to reduce operating costs and started with scanning the environment for current state of the agency. From an operational standpoint, the budget would be examined to see where expenditures are going and to review where costs might be reduced. The review found some negligent, wasteful instances of supplies being delivered to patients' homes without being charged to the patient, and this resulted in loss of reimbursement to the agency. Other large costs were attributed to overtime by the staff members and mileage reimbursement costs. Each staff member currently drives their own vehicle and they're responsible for their maintenance, such as brake repairs, oil changes, buying tires and rotations, and covering their own insurance costs. Other home care agencies in the area are using fleet managed vehicles with large decals prominently displayed, showing the name of their agency and advertisement of their services. Over 100 staff members currently on our staff are driving their own cars. Some of these vehicles are in poor condition, sometimes breaking down and resulting in call-ins from work. Mileage is logged in notebook computers by the nurses and on paper by the nursing assistants. Some staff members are logging 300 to 400 miles per week. The reimbursement rate currently is the federal government level of 51 cents per mile. So that's yielding an additional $350 a week or more for some staff members. The leaders should mention these costs to staff members and the details of what other agencies are using, putting the ideas out that another way may be better, and listen for responses. When data gathering is complete, it's time to analyze. So phase 2 is team reflection, and data is reviewed to examine what areas to strengthen, what areas to decrease or remove, and what areas to try something new. Choosing your team members is important. You want a positive group of people who are motivated, on board, and ready to work. Objective evaluation of data is necessary. So if there's a team member with negativity or pessimism, they may review the data, and it may skew their evaluation. Looking at our data, we can see an opportunity to change to company vehicles. But if we decide to go with purchasing a fleet of cars for our staff, what will it cost, and what will we gain? Other agencies are already using fleet vehicles with prominent advertising. It is possible some business is being lost to these other agencies because we are not as visible in the community. So the advertising could bring in more business. It is a big expense to pay this reimbursement to the staff. But what would it cost for us to cover the insurance on all these people? What will be the reaction of staff members who are dependent on the extra income from their mileage, especially the nursing assistants who may be making more money from their mileage reimbursement than their hourly wage? It may be like their income is cut in half. Who will be responsible for maintaining the fleet? It will be no easy task to keep 100 cars in good condition and safely on the road. Other agencies seem to have good success with their fleet programs, and the idea of a fleet is looking more and more promising. On top of that, when the idea was brought up to some staff members, they seemed eager to have the opportunity to drive a newer car. Maybe the new cars would have better air conditioning, and that would be wonderful in the summer heat. The next step is integration. Phase 3 is integration of the ideas into a plan and working out details. Local auto dealerships were contacted to check prices on purchasing a fleet of cars. Other local shops were contacted to get prices for having custom decal wrapping with the agency logo and contact information. The decision was made to contract with a fleet management company who would maintain the vehicles and then purchase them from the agency to put into rental fleet while they still had fairly low mileage, and the process would start over. The fleet management company reviewed costs, which included analyzing the driving records of current employees to determine the risk for insuring each of them and the cost of maintaining the new vehicles. The plan is to have an agency credit card to use for fuel purchases and oil changes, which may be done at numerous locations. Repairs will be brought to the dealership to ensure the highest quality repair, and these will also be paid with the company credit card. Staff members may use the cars for short errands before and after work, such as dropping children off at school or stopping by the grocery store on the way home. For this benefit, the staff member will be responsible for keeping the cars clean. Before the order was placed with the dealership, each staff member was contacted and asked if they would be willing to use a fleet vehicle. If they refused, it will not be enforced right away, but the mileage reimbursement at the time of rollout will decrease to the equivalent cost of operating the fleet vehicle. The plan is to roll out the fleet within 4 to 6 months and revisit the staff members who are opting out in 10 to 12 months with a cost analysis at that time. This decision was helpful to the nurses who are financially dependent on the mileage reimbursement and would give them time to adjust finances if they decided to take a fleet vehicle at the review date. The staff members were given online safe driver training, which had to be completed prior to receiving their fleet vehicle, which helped to lower insurance costs. Overall excitement grew as the rollout day approached, and the integration was successful. Time will tell when the cost analysis is examined to see how much the agency has saved with this decision. So in conclusion, the steps to change are the most crucial part. You don't want to push ahead with something that you think is a good idea and then realize it's fatally flawed. Assess your environment carefully. Choose a motivated and logical team to look at the evidence carefully and come up with ideas. Communicate early with key players who will be directly affected and give them rationale, background, and information. When the best evidence has been gleaned, integrate the information into a solid plan with a definite timeline and set the action into motion. Then be supportive of your team as they modify their behaviors and make the change a reality. We all change. It is the only constant and the only way to survive. Thank you.